another segment of Cancer Tamer. I'm your host, Dr. Charlie Ferrer. I'm a clinical sexologist and sex therapist, so I deal a lot with sexuality. And I wanted to make this show about ways that you can help learn about different aspects of cancer, as well as different things and treatments that may not be the norm, like cancer and radiation. Everybody knows about that. But we want to look at other things because sometimes we want to be more holistic. And remember that all the opinions on this show are my own or those of the guests that are attending and with us. So always always ask your physician if you have any questions. And of course, as Deborah Santulli Barone, who does our segment on Did You Know, she's always telling you about do your own research. So make sure you do that. So today I want to introduce you to one of our new segments with Dr. Anita Nichelle, who's going to be talking about nutrition. And the awesome thing about her is that she's actually a special type of doctor, and that's a functional medicine physician. And I'm going to have her tell you a little bit about what that means. So welcome.
Thank you, Charlie. Functional medicine, or as many people may be familiar with the word integrative medicine, and they can be used interchangeably, functional medicine, integrative medicine. It's about integrating our traditional allopathic therapies with functional therapies such as nutrition, mind, body, energy, values to health. And so it generally is a type of medicine that we were not traditionally trained to think that way. It generally gets to the why. Why is this happening? Traditionally, we are trained to treat symptoms. And functional medicine is about asking the why for those symptoms.
And I believe we had a discussion once before where you also said functional medicine is looking at everything.
Yes.
Like your environment and the way you live and how you live and what you eat and so on.
Yes,
Can you say a little bit about
you're
that?
absolutely right. You can think of functional medicine as we refer to the functional matrix is mind, body, and soul. So understanding that there is a connection between your thoughts and how those thoughts transcend your physical state, but also what drives the thoughts. And so in the question of what drives the thoughts, we think of energy or soul. And, for a lot of doctors, saying, well, what is soul, or what is energy? Well, I'm sure many of your audiences have experienced that you have a thought that can literally drain your energy. And when that happens, the body then is responding to whatever that thought is. And I'm sure many of your audiences, and specifically mothers, have experienced this, that something goes wrong with their child and their knees go weak. That is a drain of energy. And so it is difficult to address your health without really thinking of mind, body, and energy. And so, how do you maintain those three parts? Because that is what is equivalent to good health.
And that's why we can't separate them. If we're only treating one aspect, we're only treating the body, then we're forgetting the mind.
Correct.
And so the mind is working against us or may not know how to work in conjunction with.
Absolutely. It is that stress piece that generally we understand in medicine that it affects health tremendously. What we do not understand in traditional medicine is how do we address that part. So functional medicine addresses all three of those pieces. It's about mind, body, and soul, or mind, body, and energy.
And the piece that most doctors don't feel comfortable talking about is that soul piece.
Exactly.
It's that inner working, because and what I find funny is because I sometimes, and you see it a lot in the movies, where the doctor says, I don't know what else, we'll just have to pray, or I don't know what else to do, we just have to hope that the person's a fighter or they'll do that. And so
exactly.
that's the soul aspect, correct?
And you are absolutely right, and we have seen it, or we have experienced it at some level, that say, okay, it's time to pray. But what does that mean, really? It's not simply about praying. It's about really harnessing positivity. It's about harnessing your positive energy. And, there's the saying that what the brain hears, it follows through. So if we tell the brain that we are going to be expecting this, and we truly are aligned with that positive energy, then the brain will do everything in its power to transcend the space to the physical spaces that requires that energy. So functional medicine is just absolutely phenomenal. In my practice of 6 years, the things I have seen, the conditions that I was able to address has simply been remarkable.
Awesome.
And, to understand that when you empower a patient, when you empower a person, that they can drive their health, then everything changes. It is a complete game changer.
And that is one of the things that we try to do here at Cancer Tamer, is making sure that we advocate, and not only us advocating for a patient, but reminding the patients you need to advocate for yourself.
Correct.
Because no one else will do it for you.
Absolutely.
And no one else will do it as good as you, even though you might think, well, I don't know how to advocate for myself, or I don't know what to say or what to do, or I don't have the education. You don't need the education, you need to just stand up. And while we're on education,
Absolutely.
what type of education do you need for a functional medicine physician?
Well, I was retrained from the original way that I thought, and that I was taught, rather. And, traditionally we are about symptoms. We are about, well, if a person is suffering from this symptom, you can give them this medication to take away those symptoms. And in the functional approach, it's that if we can look at the basic physiology and metabolism of the body, then we can try to find the answers to those symptoms at looking at the physiology of the body. So the training is really, it was a pretty extensive training, because you are trained to rethink some of the things and the way you were taught previously. So yes, it's going back to the physiology textbooks. It's really going back to how does the body work at a very minute level. And also, I think the most striking thing about functional medicine is typically we are trained to think in terms of specialty. We are
So you're dividing the body up.
We are dividing.
And I hate that.
Yeah.
Because it's like, well, only this doctor can treat your throat, and only this doctor can treat your chest, and only this doctor, if you have a knee, well, my knee hurts, my elbow hurts, and my ears hurt, and the doctor says, well, I'll send you to this one, and this one.
Right.
Where I'm going, and I remember when I was a kid, it was all about, well, you go to the doctors and you only do one visit, and he treats all of you, or she treats all of you.
Precisely.
Now everyone is so specialized that you're losing something in the process, I think.
Yeah, and it's not to say that there is no need for a specialist. Absolutely there is a need for a specialist. But there's also equally a need for a functional approach, which is one doctor that understands everything about your basic head to toe, your basic physiology, your basic hormonal imbalance, your basic nutrition needs, because nutrition is what drives functional medicine. And the way nutrition drives functional medicine, it's about the patient's lifestyles. It's about what you're eating. It's about how much you're sleeping. It's about how much stress you have. It's about
how much partying you're doing.
Exactly, how much partying you're doing. So really, that piece is vital to really understanding that entire connection of it's one body, one whole body. And if we honor that whole body and we understand how the pieces connect, then yes, that is the path to health.
So that old saying of your body is your temple.
Absolutely.
I mean, I'm learning that, discovering it for myself. It's, if I do one thing and I do it wrong, and my body works one way, but if I'm juicing, or I'm eating right, or I'm walking, because I've been walking like crazy for the past 4 or 5 months, and I feel better.
Absolutely.
And I always have, before you can tell yourself an excuse like, oh, well, it's raining out, or, oh, well, my knee hurts, or, I just don't feel like it today. And so my only excuse, I can only accept one excuse at this point, because it has to be really good for me not to go for my walk.
Right.
And the only one that I could think of so far is, okay, I'm dead. So if I'm dead, I can't go for my walk, and that's a very good excuse. Because my knees hurt, or it's raining, or whatever, it's like you can get an umbrella and walk in the rain. And isn't it fun to just walk in the rain? And so I know I did a show with Carrie Gillespie, who is complementary medicine, and he's working with me on meditation. And he goes, well, how often do you meditate? And I'm thinking, well, I don't meditate. And he goes, well, you need to, have a time that's just for you. And he's working with me with that. And then it comes to realize it's like, oh, because I'm thinking meditation, you lay there and you're like, okay, breathe in, breathe out, breathe in, breathe out. Your body's relaxed. And I'm going, I never do that because it would drive me nuts. But my meditation, actually, I do it as I walk. Because I'm all by myself. I don't take my phone. I don't want to be bothered. I don't even like people walking with me. I just want to be left alone. And so I get to where I'm just concentrating on my breathing, and I'm concentrating on my walking, and when thoughts come in, they go right back out. Because I don't stop and think about them. Or if something comes in, it's like, oh, okay, I'll remember myself, or I'll remind myself about that. And then I'll go by the next block I've already forgotten, but I'll remember later. And so that whole, I started out with just 6 steps. And now I'm up to 1.5 miles on one walk. And I just love it. And every day, and every day I go out in the morning, and if I can't have it, I just start going but I haven't walked today. And I had some friends that came over from Texas, and my wonderful friend from the military, and I haven't seen her in like 32 years. And she came over, and we were hanging out, me and her husband. And I'm thinking, oh my God, I haven't done my walk. And she goes, Charlie, we've walked 5 miles today. I have my stepper with me, and we walked 5 miles because I took them and we toured all of New York City.
Oh, okay.
So it's realizing, and I'm thinking, well, that's not my quiet meditation walk. That's me telling you all about New York City and all this stuff, so it doesn't count for me. But I'm going, oh, okay. Well, it counts because we were walking, and I'm getting my exercise. But
But there is a difference.
There is a difference, because my meditation is I'm too hyper to just sit there and not do anything. But you don't have to sit. You can do other things, right?
Absolutely. And the key is, and that's fantastic that you're doing, and that is a form of meditation. Walking is a form of meditation. Exercising is a form of meditation. Just sitting quietly without breathing in and out and being mindful of your environment, your space, that is a form of meditation. And, for a lot of people, when they hear the word meditation, it's very intimidating.
Yes.
It's like, oh my God, I can't quiet
I need
my
my
mind.
yoga mat.
Exactly. But my mind? No. I can't quiet my mind. It's just constantly going and going. And it's not that. It really is about beginning somewhere. That you can start with exactly what you're doing is walking or exercising or sitting quietly. And the thing I would like to advise you not to do is when you miss that walk, don't add a stress to that by saying, oh my God, I haven't walked.
I'm stressing.
Exactly. There's no need. Just simply take a few breaths, own that space, and say, well, I haven't walked today, but I'm going to walk tomorrow. Because what you do not realize is when you get into that, oh my God, I missed my walk, is that you are inducing a stress. And when the brain hears, oh my God, I haven't walked, it does interact with what we call the hypothalamic pituitary adrenal engagement, is that the brain is sending signals down to the rest of the body, stress.
Yes, because
Right?
I am really stressed out.
Exactly.
And you can see it. I'm just like, oh my gosh, what am I going to do? Oh my gosh, my health is going to go. And then I start thinking, if I didn't walk today, I won't walk tomorrow. Oh, no.
And so I
start freaking out.
I urge you not to go there, not to engage with that, to be mindful that, okay, I've missed my walk today, but I'll walk tomorrow.
Yes.
And that's it. Leave it at that.
And it was unavoidable. It wasn't like I'm sitting on the couch eating chips.
And this is what brings about consistency. Because what happens when you get all stressed about I should have walked and I didn't walk, and so tomorrow something else will come up and it will be, oh my God, I can't do it. And so what happens is now the signal to the brain is walking is stress. And so you start to find a reason not to do it. And so it's important when you're trying to engage in a lifestyle change that you establish consistency. And when you go off those consistencies, just be mindful that I've gone off that consistency today, and tomorrow I'll get back on that consistency, and that's it.
Okay. So I don't have to feel guilty. I don't have to say anything bad, because I know sometimes we say bad things about ourselves.
Exactly.
And we need to not to do that, because then we're telling our body, oh, well, you know, how horrible you are. See, you wouldn't follow through. And now you're going down a whole another rabbit hole.
Of negativity.
Yes.
Right.
And it's just toxifying you.
It's non-productive. It's non-productive. And the nice thing about, again, functional medicine from my engagement is when I empower someone to take charge, it's amazing what that person will do. In fact, I am surprised oftentimes that someone will come back in and say, oh, you know, they will take it one step further. You know, the most challenging thing about functional medicine, I would say, is the readiness of a patient to engage. If that would be the most difficult thing, or the most difficult challenge for me, that if someone is ready to engage, then the sky is the limit in terms of what they're able to achieve for themselves, for health. And you know, health, when we talk about health, it's not simply about the absence of disease. It is about being healthy, you know, at every aspect of your life. And yes, it is a process, you know, and it is very different from what most people are used to, because most patients are used to, I have a problem, I go to my doctor, he gave me a prescription, or, you know, did some blood test, I get the results and that's it. No. Functional medicine is about, yes, we do test, it is evidence-based medicine. We do test for several conditions. We do lab testing, blood testing, saliva testing, and it is clearly the evidence is there. Excellent. The evidence, right, in a physiological shift in the body is there, and then we work from that point, with the evidence, to come about the solutions. And the solutions could be a host of things. So typically when I sit with the patient in a functional medicine consultation, it can be an hour, because I want to know everything about your life.
And I know we took like over 2 hours when we were doing mine.
Yes.
So as you can see, we have been talking here for a little bit about functional medicine, and there's so much more that we can be talking about, but we have to wrap it up. And so what I want you to do, I am inviting you to feel free to send your questions for Dr. Anita Nichelle, and she'll be able to answer them, because she has graciously agreed to be our nutritional expert and functional medicine physician on our website. So you are welcome to send those to info@cancertamer.org, and please feel free to visit our website, www.cancertamer.org, and feel free to send in your questions, your comments, or anything you want to know about. And you'll see Dr. Anita very often on our show. Thank you for watching. And now I'm going to turn it over to Deborah Santulli-Barone with our segment on Did You Know? Take it away, Deborah.
Hi, this is Deborah Santulli-Barone of Did You Know? Today we're going to talk about lymphedema. But before we get to that, let's talk about the lymphatic system. The lymphatic system runs throughout your whole body, and it's a one-way drainage. It pulls fluids through your body, it circulates in the blood. So why is that so important? Well, let me tell you. Because when you have when you're diagnosed with breast cancer, you might have a lumpectomy, which will take out the cancer lump and the tumor, or you might have a mastectomy, which you can do a bilateral, which is 2 breasts or 1 breast off. What they do during that operation is they go in and look at your lymph nodes, the lymph nodes under your arms. What they do is they first do a sentinel node biopsy. And basically, that's a few nodes that they take out to see if there's cancer. So while you're on the operating table, they will run to pathology and test it to see if there's cancer. If there isn't any cancer, which is a negative, then they won't go any further and take any more nodes out, which is a good thing. If they find some cancer, they will take out more nodes, and they will continue to take them until they find most of the cancer or just find cancer in it. So it could be a number of nodes that come out. So after that, you'll be recuperating. And what the doctor will talk about, or what they should do, is send you to a lymphedema specialist, because again, the lymphatic system is pushing fluid throughout your body. When you have lymphedema, which means your arms are swollen, the reason why they're swollen is because now the fluid can't flow as quickly and as fast throughout your body. So what happens then is that there's a buildup. Picture it like a pond that fills up and the water gets stagnant because it's not moving. It's not like a river that's moving, it's a stagnant pond. And because of that stagnation of the fluid that keeps filling up in your arm gets very swollen. Your hand gets swollen. And so the best thing, which when they send you to a lymphedema specialist, who is also an occupational therapist, she will assess how bad your lymphedema is. And then you will be, or an order would be taken to do a lymphedema sleeve. There are a few kinds of sleeves. So there's a sleeve that goes from, let's say, the upper arm, all the way like almost to your shoulder, down to your wrist. But the problem with that is you have to have that, yes, but another attachment will go with that. Because if you're tight here with the sleeve and you're tight here with the sleeve, your hand can get swollen, and that's not good. So then they put on a second piece called a gauntlet, and that goes from right below your knuckles, your fingers, to your wrist. And between the both of them, that should help you. Now, some people need to go on a machine that helps them a compression. That's okay. It's fine and it's normal. Then there's another kind of sleeve that goes from the fingers here all the way up the arm. Either one is fine depending on what your therapist decides on. Now, you have to know a few things about something when you have lymphedema. First of all, when you go for an operation or any kind of procedure and you need IV, intravenous, do not get it put in the arm with the lymphedema. You need to put it on the other arm. And the same thing goes for the blood pressure. Anytime you go to the doctor, you tell your primary doctors, your heart doctor, everyone, you cannot have that compression of blood pressure on this arm. So you can have it on this arm. But the problem arises too is that what if you have nodes taking out of both arms? So you had them here, you have them here. Now what do? Well, you have to tell your medical professionals that you go to for certain procedures or an office visit that you can't have it on either arm. So what you would do then is you would tell them that they have to do it on the leg. That also means take an IV from your ankle or wherever they can find a vein, and also to have the blood pressure machine on your leg. And the same thing holds true for just having blood work done, because let's face it, when you have cancer, you're going to need a lot of blood work. You cannot have it taken out of the arm with the lymphedema. And again, as I suggested, if you have it on both arms, the lymphedema, then you need to speak to the professionals and they will decide where else they can take the blood from. So that's very important to know, because when you have lymphedema, you can also get different kinds of infections. So the same thing, like if you get a mosquito bite on this arm, of course you can't control that, but be aware of it, watch it, make sure it doesn't get red or swollen or hot, because then you might have an infection and you should see a doctor as soon as possible. That's very important. So how do we prevent this? How do we prevent infections? Because sometimes we can't prevent lymphedema, but we can prevent infection. Well, first of all, don't wear tight clothing. Don't wear tight watches or jewelry or tight rings. It's very important. Be careful when you're cooking or you're taking stuff out of the oven. Make sure you wear mitts, because you don't want to have any burns that can turn to infections. That's very important. When you are on a plane, the air pressure is certainly different than what we have here. when you're on land. So what do? You have to wear your compression sleeve. And it means going from here, the fingers, all the way up the arm. And your doctor, of course, will know best, but you should also be an advocate and be able to ask these questions or demand what you need to have. It's very important with that. Now, carrying heavy items is another factor. The arm that has the lymphedema, you shouldn't carry anything heavy on that arm. And if two arms have lymphedema, well, it's time to find someone to carry your weight, as I always say. And the same thing goes for housework or strenuous work. Gardening, take your time. Don't get, wear gloves so you don't get cut with any thorns. And it's very important with any kind of cuts that you get. You have to be extremely careful. And don't forget, if you think you have lymphedema and you think it's infected, you need to call your doctor right away, because maybe you would be prescribed antibiotics for something like that. And you need to see a specialist and make sure the specialist is licensed. And the same thing goes for if they're going to do occupational therapy. Now you might ask, why occupational therapy? Well, sometimes when you have node biopsies, your arms hurt a lot because they're pulling. Every time you lift it, it's pulling on the breast that had an operation. And it gets very tight, the muscle under here. So you need to sometimes occupational therapy, which will push the muscles up and will move the muscles around. You can actually do some stuff at home, but you need to talk to your doctor about it. You can lean against the wall with your hands against the wall and push slightly, or you can try to climb up the wall, because if you wait too long after your operation, your arm can freeze, and then you need more occupational therapy. So that's important to know that. Now you can also go to a massage therapist and have a massage. It's very good for you. Do not do the massage on your own. It's imperative that a licensed massage person that has worked with cancer patients, who is certified, so that they can teach you exactly what can be done. Because if you're massaging yourself, you might be pushing the lymph node, the liquid in one spot, and then it stays in one spot, and then it gets bigger and bigger and bigger. That's not a good idea, because it could also cut off circulation. So what you need to do is find a licensed, certified massage therapist. And besides that, I feel that you need to be able to go to a place where other people have lymphedema. I suggest a support group, so that you're talking with women that have the same problem and that they can help you through it too. Because it could be dealt with very easily, and it's time that you should be able to do this with the feelings that you have about it. And it's not embarrassing. There are a lot of people that have it, and it could be rectified to a certain extent. So here I am today on Did You Know? And I hope to see you again soon. And thank you so much for tuning in. This is Deborah Santulli-Barone. Thank you.
Hi. That's it for our show today. I hope you got all the information you needed. And as always, feel free to send in your questions, your comments, and even if you want us to research something for you, which you should be researching on your own, remember that. So thank you for watching, and feel free to contact us at info@cancertamer.org and visit our website, cancertamer.org. This is Dr. Charlie Ferrer for Cancer Tamer. Thanks for watching.